Good afternoon to everybody. I'm Dr. Muthukumaran. I'm the pediatric cardiologist at Apollo Children's Hospital. This is Dr. Neville Solomon. He's a chief cardiac surgeon. We have Dr. Ganapati with us. He's a cardiac surgeon at Apollo Children's Hospital. And Dr. Prasad Manne. He's a pediatric cardiologist as well. Here we are gathered to share our success with Salim and his father Mohammed. Hello. They actually came to us in 2010, where Salim was diagnosed to have heart block and had a pacemaker put in locally. He developed what we call pacemaker induced cardiomyopathy, where a pacemaker was put in but the heart was not pumping properly. So they came to us. At this time we discussed what the best thing to do. He had a normal pacemaker which can do this kind of activities. So we went for what we call cardiac resynchronization therapy, where we paced his right ventricle and left ventricle. This was done by Dr. Neville Solomon, and we referred him to Dr. Karthikeyan, and both of them did the procedure.
Good afternoon. So I remember Salim from 3 years ago, and he came as a very sick child from Oman, and it's a testimony to our team effort because we needed the input of the cardiologist, our pediatric cardiologist, Dr. Muthukumaran at the time, and then Dr. Karthikeyan, who's our electrophysiologist, and also our post-op team, because we formulated a good plan to put 3 leads on the heart, and at that time the heart was hardly pumping. The ejection fraction was 20%, which is very bad, and the heart was struggling for about 1 week post-operatively, and the child had to be on a ventilator for a very long time. So here I would like to acknowledge my anesthetist and my post-operative intensivists and nurses who took care of Salim so well, and he subsequently went home. And when he came for a follow-up last week, I could not believe the echo when a pediatric cardiologist showed it to us. The ejection fraction had come back to normal. So this is a very satisfying case because the child came with hardly any pumping action, and now his heart is as strong as mine or yours, and it's a testimony to our team effort and the Apollo banner. Thank you.
بسم الله الرحمن الرحيم. السلام عليكم. محمد حميد القلندي من سلطنة عمان. أول زيارة كانت لي في مستشفى أبولو للأطفال كانت سنة 2010 في شهر 8 تاريخ 19، وأيضا الحمد لله رب العالمين تمت عملية استبدال الباتري للجهاز الأول، والحمد لله كل شيء تم على أكمل وجه، وأشكر الحمد لله رب العالمين على كل حال. وسالم الحمد لله الحين وضعه طيب وحالته الحمد لله الصحية مطمنة والحمد لله رب العالمين. وأشكر إدارة مستشفى أبولو للأطفال صراحة، والدكاترة ما قصروا، دكتور متوكمران مع بقية الدكاترة جزاهم الله خير. والحمد لله أنصح كل مواطن وكل مريض صراحة معاه هذا المرض إنه يراجع مستشفى أبولو بدون أي تردد. شكرا جزاكم الله خير.
I'm Dr. Karthikeyan, consultant cardiac electrophysiologist at Apollo Hospital. This boy, Salim Muhammad, was referred to us 2 years back with the symptoms of refractory heart failure for evaluation and treatment. This boy has been suffering from congenital complete heart block, which was detected even before his birth when he was inside his mother's womb. And then as soon as baby was delivered, his heart rate was found to be very low. So he underwent an epicardial permanent pacemaker implantation at Middle East. After that, he continued to develop breathing difficulty and his pumping function was deteriorating. So he was repeatedly hospitalized at the Middle East hospital for heart failure symptoms and respiratory infections. So when he was at the age of 1.5 years old, he was referred to our Apollo Hospital for further evaluation and treatment. Looking at his condition, the pumping was hardly 20% LV ejection fraction, and there is a patient who was suffering from refractory heart failure. So there was no scope without upgrading the pacemaker to a triple chamber pacemaker. But triple chamber pacemaker, by and large, it is done mainly for adult grown-up human beings, for those who have refractory heart failures. So, but this is the first time we have suggested for this patient at such a young age, 1.5 years, to trying to improve his heart condition so that he will do better in the future. So we did a open heart surgery in this form of open chest procedure, implanted a triple chamber pacemaker. So the kid was shown improvement when he came for follow-up after 3 months. The ejection fraction from 20% improved to 35%, and that patient was asymptomatic. And after 2 years, when he came for follow-up, the ejection fraction improved to near normal, 55 to 60%. And the kid was absolutely asymptomatic since the last 2 years, not even required any hospitalization in the last 2.5 years after the procedure. The importance here in this procedure is these procedures are done for the adult, grown-up people. This we have done for such a small 1.5-year-old boy in an open chest procedure, and which has shown the dramatic improvement in these patients, which is first time in India, which is done for such a small baby open heart procedure. And this is very important for the awareness of the other public also. Those who have the poor pumping in an ideal situation, this sort of triple chamber pacemaker will likely to improve their cardiac status and give benefit to the patient. The success behind this baby's improvement, goes to the whole team which involved in this procedure. Myself, Dr. Neville Solomon is a pediatric cardiac surgeon, and also Dr. Muthukumaran is a pediatric cardiologist. We put our efforts to the whole process in evaluation and treatment, implanting the device and subsequent follow-up, and keep optimizing the device for the patient's well-being, and also equal importance the medical treatment which was titrated to the pediatric cardiologist, which has shown put our efforts shown to the benefit. The patient heart condition has improved dramatically, and is like playing like any other kid without any heart failure symptoms. He's playing with his siblings and other kids like any other child. His heart condition is as equivalent to anybody else at his age.